Hey guys, I am Dr. Victoria Munoz, and I'm coming here tonight to bring to you a very important topic, and we're going to talk about inflammation. Inflammation is key in our ability to heal, and there are many implications to inflammation and how it affects us physiologically. And so, in order to optimize our health and to reap the best benefits of a long life, we definitely need to understand inflammation and how it works. So I'm going to address inflammation in general, and then we're going to talk about the different kinds of inflammation and their benefits and their not, their health risks. So inflammation is something that happens as a result of the immune system kicking into high gear when we have like acute injury or infection. And it's actually the body's way of protecting itself from harm in an attempt to repair damaged tissue or remove pathogens. So following an acute injury or infection, for example, inflammation begins within seconds. And immediately following an injury, for example, redness and swelling will begin to appear, and that is a good thing. So what you'll see physiologically is blood vessels will become more permeable, allowing fluid and proteins to move into the what's called interstitial space, which is the space between damaged cells. And this is necessary in order for the immune system to move in and begin cleaning up and repairing the injury. So on the surface over the injury, you will see that the skin will become reddened and warm, and this is actually evidence that inflammation is taking place in order to begin the healing process. So inflammation is meant to cause healing of injury to the body, but there are times when inflammation isn't so beneficial. So anyway, the four phases of wound healing. We've got homeostasis. Homeostasis begins at the onset of injury. And the goal in this initial step is to control bleeding by initiating a clotting cascade. Okay, and we just kind of talked a little bit about inflammation, which begins simultaneously or shortly after this clotting is initiated. So following homeostasis and inflammation, we have the proliferative stage, which is when the wound is filled with new healthy cells, and then maturation, which during this phase, the newly laid tissue gradually gains strength and flexibility. So our body, inflammation is our body's attempt to repair itself and heal itself. Now, in terms of the different types of inflammation, we have acute and chronic inflammation. So acute inflammation happens over a matter of hours to days, and chronic inflammation will linger over months to years. Now, inflammation is the body's way of repairing and healing, like I said, after an injury, but this should only last for a few weeks. And when inflammation continues over months or even years, it becomes problematic. So chronic inflammation is more serious. It's a more serious condition that poses many health problems, and it is a silent killer. It actually contributes to 7 of the top 10 causes of diseases in the United States. So some contributing factors to chronic inflammation are poor diet, lack of exercise, poor lifestyle choices such as smoking and exposure to environmental toxins. And we're going to touch a little bit on this in just a minute. So, excuse me, what are some of the symptoms of inflammation? Well, they can be very vague, such as fatigue, sleep problems, generalized pain. Your patient could be having joint pain, headaches, including migraines, brain fog, skin rashes, irritations, eczema, psoriasis and acne, allergy symptoms, GI symptoms such as gas, bloating, cramps, constipation, diarrhea, reflux, PMS, mood issues such as depression, anxiety, irritability, and agitation, high blood sugar, weight gain, and frequent colds and flus, just to name a few. So sadly, many of these conditions drive people to go and seek medical attention, and many doctors only know how to treat symptoms with pharmaceutical intervention rather than addressing the cause. And this is a big problem because it doesn't really help ultimately get the patient better. It's just really masking the symptoms. So, causes of inflammation. So, one of the biggest causes of inflammation is sugar in the diet. And sugar is defined as cane sugar, high fructose corn syrup, and these substances are added to processed foods as a sweetening flavor or preservative. This includes bleached flour, refined carbohydrates found in cookies, candies, cakes, and sodas. It has been proven that eating just 50 grams of refined carbohydrates greatly increases inflammatory markers in the blood. So too much sugar in the diet leads to oxidative stress and inflammation. And all of these factors will cause low-grade chronic inflammation. As a result, we become more susceptible to developing chronic disease such as atherosclerosis, which is the hardening of the arteries, heart disease, stroke, diabetes, and cancer. Another common cause of inflammation is emotional stress. Stress in the form of panic, irritability, anxiety causes cortisol to be released from the adrenal glands. And when cortisol and adrenaline are released, our bodies are preparing for taking quick action, which is known as the fight or flight response. Now, this response serves a very important purpose. It keeps us away, it keeps us from getting into a dangerous situation, possibly losing our lives. So when we have this response, we're on high alert, and this is largely due to cortisol and adrenaline. So the problem with this is that if you continue to be stressed after the source of immediate danger is removed, then you enter in what's called a chronic state of stress, which serves no functional purpose. And cortisol, like I said, is inflammatory. And when cortisol is released over long periods of time, chronic inflammation is the result, which damages tissue in the body and causes injury to our cells. So, so it's pretty important to manage our stress levels. Now we move into another form of stress, which is physical stress. And stress can also be caused by many physical causes. For example, if our blood sugar is low, our body will work to normalize these levels in order to bring the body back into balance. And our liver, what will happen is it will release glycogen through a process called gluconeogenesis to reestablish homeostasis. Well, low blood sugar, it causes symptoms such as shakiness, sweating, lethargy, and these symptoms remind us to consume carbohydrates. So another form of physical stress can be exercise-induced, and so moderate exercise serves to improve immune function and health. However, high-intensity exercise causes the breakdown of muscle tissue, which requires our immune system to be activated for repair. So in the case of competitive athletes and professional athletes, excuse me, who are functioning at high intensity on a daily basis, this really doesn't allow for the adequate recovery time before the next session, and as a result, the immune system is on overdrive, causing chronic inflammation. This makes them, these athletes, more susceptible to injury and colds and flu. So also there's digestive issues. Now, I say this over and over again, inflammation starts in the gut, okay? And the gut is primarily where a lot of chronic disease begins. This is not only due to poor diet, but the many forms of stress that we just talked about can also cause our gut to become inflamed. So when our diets are poor and we are chronically stressed out, toxins and cortisol work together to destroy the gut lining, and ultimately we end up with leaky gut. And we begin to have symptoms of poor digestion, such as gas, bloating, abdominal pain, constipation, diarrhea, and acid reflux. By better managing our stress and consuming an anti-inflammatory diet containing, for example, omega-3 fatty acids, fermented foods, plenty of plant foods and dark green leafy vegetables, we can begin to optimize our health and reduce inflammation in our bodies. And to expand on diet a little bit, the consumption of fast foods and processed foods has become all too commonplace. If you shop the center aisles of the grocery store, you will find few items that contain whole foods. So these processed foods are nothing more than chemicals, artificial flavors, sweeteners, additives, and preservatives with minimal nutritional value. And the reason manufacturers add these ingredients to your food is to make it look and taste appealing after all the nutrients and flavor have been processed out of it. This is a reason for fortification. I'm not going to talk about fortified foods right now, but it was a process that the FDA initiated in the 1980s due to prevalent disease related to nutritional deficiencies as a result of processing foods. Another common culprit of inflammation is allergies, food allergies to be specific. An allergy is an immune response to substances which cause inflammation and ultimately cell damage in the body. So an allergy occurs when we become sensitized to a substance that we are exposed to. It is unknown why this happens, but it's typically the second exposure that causes a reaction, whether it be a food or an environmental component. So the first time we are exposed to something foreign, such as a food or a chemical, the immune system will identify it as safe or harmful. And if the immune system determines that the substance is harmful, it would develop antibodies against that substance. That's essentially what a food allergy is when our body determines that for whatever reason, and it's often unknown, it could be something that can be seemingly healthy, like a strawberry or broccoli, and for some reason our immune system just doesn't want to have it in our system and will start to work against it. And like I said, it's largely unknown why this happens, but it's very individualized too. So, so food allergies can cause irritation of the digestive and respiratory tract, as well as generalized symptoms. GI and respiratory symptoms of food allergies might include gas, bloating, diarrhea, constipation, nasal congestion, and asthma, just to name a few. And the more generalized symptoms would include symptoms such as fatigue, muscle and joint pain, headaches, and brain fog. Foods that are commonly considered healthy, like I said, will cause severe symptoms and health problems in sensitized individuals. So, and there are 4 types of important immune reactions that we must consider when we're talking about allergies. It's IgM, IgA, IgG, and IgE. And I'm not going to go into this right now, but what I do is when my patients come into the clinic and when we talk about what's going on in terms of their food allergies or the symptoms they're having, when I test for food allergies, I test based on their symptoms, and IgE, IgA, IgG, and IgM are very specific in how they present, and so that tells me what kind of food allergies I need to test for. Another cause of inflammation, obesity. Obesity causes inflammation in a couple of different ways. So obese individuals are prone to type 2 diabetes, high glucose levels, like we talked about sugar in the blood and how it's very inflammatory due to insulin resistance associated with type 2 diabetes causes chronic inflammation. So when we eat sugar, it goes through the digestive tract and enters the bloodstream. Now, as blood sugar rises, inflammatory messengers called cytokines increase in number. And with diabetes, sugar levels in the blood remain higher than normal, and cause chronic inflammation. In addition, fat cells release chemicals known as the cytokines, like I just mentioned, which increase inflammation even further. So It also is proven that excess inflammation in the body increases the risk of type 2 diabetes. So this is feeding the problem even further. Excessive abdominal fat is especially problematic when it comes to inflammation, ultimately altering the action of insulin and causing disease. So it's kind of a problem that feeds on itself. Sugar and high sugar levels, obesity, fat can cause diabetes. Diabetes can cause these things. So it's important to get this under control for sure and manage it. Now, hormones. Hormones are something that are really important to address when it comes to inflammation. What some people don't know is that hormones play a very large role in managing inflammation. So there are numerous hormones in the human body, each with a different role. And hormones are basically, they're chemical messengers that control most major bodily functions. Glands that produce hormones are called endocrine glands, and the collection of these glands are known as the endocrine system. So some of the major functions of hormones is to control hunger, manage energy levels, balance metabolism, increase libido, maintain lean body mass such as muscle, induce fertility, and much, much more. So hormones play a very important role in managing inflammation and giving us quality of life. So when certain hormones are out of balance, such as, for example, deficiency or an excess, inflammation may be present. And some of the important hormones we're looking at in inflammation in the body are testosterone and estrogen, thyroid hormone, and insulin, glucagon, leptin, and adiponectin, and cortisol. So I'm not going to go into all these in detail right now, but I'm just going to touch a little bit on a couple of them. So like I said, certain hormone deficiencies can cause an increase in inflammatory levels in the body. Where there is pain, there is inflammation, and when we look at chronic pain and the role that inflammation plays, we must consider gonadal or sex hormones. So these hormones, primarily testosterone and estrogen, are responsible for improving lean body mass, healthy hair, skin, connective tissue in our bodies, and metabolic processes. Testosterone and estrogen are sex hormones found in both men and women, but they're found in different ratios. So estrogen is primarily a female sex hormone, and there are 3 different estrogens produced by the human body, but estradiol is the primary estrogen. I'm not going to go into detail on estrogens right now, but the presence of estrogen also plays a very important role in healthy skin, joints, and connective tissue. So women who are approaching perimenopause or even menopause, estradiol levels start to decline. What happens is estradiol is responsible, and the decline in estradiol is what's responsible for the symptoms of menopause, that women experience. So estrogen has an effect on keeping inflammation down as well. And in addition to other symptoms, as menopause approaches, women may experience hair loss, dry skin, joint pain, as inflammation in the body rises. Now, testosterone is primarily a male sex hormone and is produced primarily by the testes. A small amount is also produced by the adrenal glands, especially in females. It causes puberty, increases bone density, causes increases in muscle mass and strength, hair growth of the face for men, and in recent years, testosterone has been known to play a very proactive role in the human body. As we age, our bodies lose the ability to stop inflammation, and this is largely due to cytokine production. As the cytokines are produced by the immune system, and they basically follow inflammation. So as men approach middle age, like 45, 50, there is a progressive decline in serum testosterone levels. androgens have been shown to inhibit the expression of cytokines, which are inflammatory, and thus helping to manage levels of inflammation in the body. In addition, supplemental testosterone is proven to reduce inflammatory markers in men of all ages. There's also thyroid hormone. Thyroid hormone is important for metabolism and our heart rate. I'm not going to go into detail about thyroid hormone right now, but when the thyroid is out of balance, our metabolic processes slow down significantly, causing further inflammation in the body. And as we discussed, when we are stressed, our adrenal glands produce excess amounts of cortisol. Cortisol is inflammatory, and high levels over time set us up for health issues related to chronic inflammation. As cortisol production increases, thyroid hormone production decreases. This is due to the fact that cortisol inhibits TSH, which is thyroid stimulating hormone production, thus inhibiting the production of thyroid hormone. So these two hormones work very much in balance with one another, and it's very important to address them both if there is any kind of imbalance with the adrenals or the thyroid hormone. In fact, with my patients who have low thyroid, often you'll see that the adrenal glands are kind of kicking into high gear to try and make up for it, because the body is wanting its energy levels to come up, knowing that it's having problems with metabolism, and it will typically go to its go-to, which is the adrenal glands. So hey guys, another thing is environmental toxins. I'm not going to go into detail about environmental toxins right now, but there are a number of environmental toxins that greatly contribute to inflammation in our bodies, highly toxic, highly dangerous, cancer causing heart disease, and other things that can be very deleterious to our health. So the bottom line is, all these things are really big and scary, and when I present them, it can seem that way. However, reducing inflammation in the body and living a healthy lifestyle really isn't that hard. When my patients come into my clinic, I typically do a very thorough intake, and I kind of look at symptoms that my patient's having. One very important thing that I do is I start by addressing gut healing, and I address the diet and get my patient's diet very anti-inflammatory. Now, this is important for healing, and one thing that I find is that when my patients come in with 10, 20 symptoms of just feeling horrible and having a hard time functioning, getting through their workouts and whatnot, often just the gut healing and the diet can greatly increase and improve a lot of the symptoms, alleviate a lot of the symptoms they're having, and improve how they're feeling. However, that's not the only thing that we have to do. We have to do blood work, and we have to address, the different hormone levels that we just talked about, and vitamin D levels. We have to look at the adrenal glands. There might be an iron deficiency and so forth. So, inflammation is very important subject when it comes to healing and ultimately managing our health. And like I said, inflammation plays a very positive role in healing, but chronic inflammation not so much. You can kind of use the analogy of a faucet. Acute inflammation is like when you have a faucet and it's turned on fully, and and the water is coming out full force. That is like acute inflammation. It's doing work and it's serving a purpose. However, when you have a leaky faucet that maybe has, a faulty washer or something in it, and it's just dripping, doing more damage than good, not really serving any purpose, that's kind of what chronic inflammation is to the body. It doesn't really do any work. It's just doing a lot of damage. And over time, this is the result of chronic disease and illness. So, hey guys, I hope this was helpful. I'm Dr. Victoria Munoz, and I'm a regenerative sports medicine doctor. I also do anti-aging. I just wanted to come to you and present some information about inflammation, because a lot of people don't understand that how inflammation affects our health. When my patients come in to me and they have like joint pain, back pain, I can do a regenerative treatment, but if we don't optimize them, get their inflammatory markers down and get their immune system well balanced, then they're not going to heal as well as if these things aren't addressed. So, hey guys, I'm going to let you get on with your evening. I'm going to get on with mine. If you have any questions, please message me. I'm gonna. I've put my website in the description. I'm going to also upload this video to my YouTube channel, and I will put the link in the description below as soon as I'm done here. And again, if you have any questions, please contact me. And hey, until next time, be well, and I look forward to talking to you again soon. Bye-bye.